Hey, my name is Alex Arcos. My pronouns are he, him, they, them, and I am a gender fluid transmasculine person who is about to go through top surgery. I always want to have a YouTube because I want to edit things the way that I see them with my psychotic hallucinations, and make a little circus for myself. But I ran out of time because I slacked. So, here's my YouTube. I am about to undergo gender confirmation surgery on my boys, man. um, I guess for this first video, since it's the introduction, I will explain the procedure that's gonna happen and, like, what my initial relationship is to the boys. Um, so, um, gender confirmation surgery, right? I guess I'll show you them because I'm sorry, I'm like, I don't know. I'll show you guys just because, this is actually for science, like research purposes. Probably end up editing this in some way to like not get me ruined by sexism. Okay, so these are the men. Basically, they're gonna cut under here and slip it all out and then stitch it back up, like, without that, normal nipple placement. Yeah. And so these bad boys, after tomorrow, will be gone. I am gonna not be able to skate for 2 to 3 months, or actually they said 1 to 2 months, but I'm gonna say 2 to 3 months. I'll have to learn how to work out my muscles differently. So my relationship, I guess, to my boobs, right? Well, so after that, the recovery is supposed to be a good, like, well, 2 to 3 months till I can skate. So I'm assuming that's when the recovery is, right? Like, I don't know. I didn't do a lot of research before this, and I am a little scared. I've had bad luck this past year, so there's big anxiety in me that I could just die during surgery, even though the doctor said as close to 0% chance of me not dying is what I got. And like, here I am talking about dying again. Depression things. This has been a hard year for me. Besides Corona, I'll probably open up about that like later though, so that it's not the premise of this first video. This first video is for me to explain just like the beginnings of top surgery. I am trans and dying, and so basically my relationship to my boobs, right? Like, if I was a cis woman, because I'm AFAB, so like if I was a cis woman, I would love them. Honestly, like, these aren't bad. If I saw my boobs on someone else, I would be like, oh, nice boobs. But I was not born a cis woman, and they cause me some serious gender dysphoria, especially in terms of like other people respecting my gender. I find that a lot of people use the fact that I have boobs as an excuse because Corona, I couldn't wear my binder, Also, in general, I'd gained a lot of weight this past year, and wearing a binder was not as much of an option as it should have been, like, or at least as like I wish it was. I like when it comes to like sex and stuff, I feel whenever anyone touched my boobs or did anything to them, I was kind of like, it's not like it didn't feel good, but it was more like, why are you doing that? Like, if someone else, I'm like, ah, titties, but like, if it's me, I was just kind of like, you like that? Like, why? I'm always just like, what's good with that, It makes no sense. Um, and I was explaining it to my friend also that, like, my relationship with them is good, like, besides the dysphoria they give me, it's not their fault. And, like, they don't feel any type of way about getting cut off. They're more, like, happy that I'm happy. My titties are very, like, they're very, they knew they were on the wrong body, It's not like hurting their feelings by getting this mastectomy, this bilateral mastectomy. So, on that note, there's more stuff I think I'm gonna want to talk about in terms of being trans and explaining who I am to y'all in this queer setting. I think I will make another YouTube probably after this, but that's not coming for a hot minute, okay? For all my friends, and I don't know, even if none of you watch this and this vlog is just for me, I'm gonna start vlogging now. I'm recording this on my laptop with a backup on my phone. It's gonna be recorded through both. I'm gonna learn more about editing and stuff. It's gonna be interesting. Thank you for accompanying me on this fucking crazy journey. It's gonna get personal. And don't sexualize my body, and stay safe. I don't know. I'll come up with something to end these soon.